Hi there, it's Dr. Greg Gorman. I'm doing another in my series of videos about things you're going to encounter in clinical practice that you may not have learned about in school. So today I want to talk about people who think you hurt them. Um, so luckily this doesn't happen very often, but I remember the first time I heard about this, I was in Boston and I had a couple of new patients come in and they were transferring care from other doctors, and there were other doctors in the Boston area. So clearly it was either, convenience, price, or they didn't like the other doctor. So I don't get too caught up in those kind of discussions when they're coming in from another chiropractor, because I don't want to be in a position where I'm criticizing or listening to them criticize another doctor, because a lot of it is very subjective. You either like and resonate with a doctor or you don't. And if you don't, you should definitely move on, which these people were doing. But they definitely wanted to let me know they did not like the doctor because he over-adjusted them. And that was really curious to me. What is over-adjusting mean? I think what they mean is he just was too rough and going too hard. So I didn't really engage them too much on that, and luckily they liked me. And then about maybe a year into practice, this guy came in to see me, and he was a computer engineer, and he worked on wired networks. I'm totally dating myself here because there used to not be wireless networks. And he carried around heavy tools with him, and he was crawling under desks and then crawl spaces and alcoves and all that. And it was a pretty demanding job physically. And he had a very sore neck, decreased range of motion, pretty significant pain in the cervical thoracic junction, and levator scapula is just screaming at him. So I got down to business and I adjusted him, and he came for a follow-up a few days later, and he was thrilled. Because he felt significantly better. Now, I'm going to do a video on people like that too, because you want to be a little bit cautious taking responsibility for the massive miracle, because sometimes those people have a longer road ahead of them than it would appear getting out of pain. So anyway, he comes in and he's thrilled that I got him out of pain. So I worked on him, and then I was going on vacation, and I asked him to follow up with the woman that was going to be covering for me. She practiced right near my office. She was awesome. She did ART as well. So he was in really good hands. I trusted her. I liked her. And I came back from vacation, and the guy came for his follow-up. I think it was his fourth session that he'd had, and one of them was with the doctor that was covering for me. So I said, "How are you doing?" And he said, "Well, I'm not very good. That doctor pushed everything the wrong way." And I was like, well, I don't think that she does that. I trust her pretty well. Can you tell me a little bit more about what's going on? And basically what he said is that he had felt much better when she worked on him, but a day or so later, he was back in pain again, and that did not happen when I adjusted him. However, I think if I had adjusted him that time, he would have been in pain as well, because it was an ergonomic issue. It was the heavy bag. It was the crawling under the desks. There was not a doctor pushing everything the wrong way. So I explained that to him. I talked to him about the ergonomics and re-injuring body parts and all that kind of stuff, and he seemed to get it. Now, I just want to take a quick moment to chat about what it would look like if I had over-adjusted him. If you over-adjust, if you go too hard, if you're too rough, the patient's going to be in pain right away. I saw a doctor. This has only happened to me one time. This was before I was a chiropractor. I was living in Boston, and I had a chiropractor that was in Cambridge, and it was a bit of a schlep on the T going over there after work. So I wanted to find somebody who was a little bit more convenient, and there was a guy right by my gym. So I scheduled an appointment with him, and I was really surprised when he adjusted my neck, because it hurt so much. And I'd had experience with several different chiropractors at that point. So I had never been in pain. Usually I would just feel better, which is what we want and what we expect, and also what the patients want and expect. So I went about 3 times, and each time it was the same thing except worse pain. I didn't walk out of there. I walked out of there in pain. I didn't walk in pain. I walked out in pain. So it was pretty clear to me that that's this guy. He's too rough. Don't go back. So I didn't. When you do something like that, it's going to be gross trauma. The patient is going to feel it right away. This is not something that's going to crop up 2, 3, 4 days or even a week later. But in the patient's mind, it can be about what you did, and it may very well be about what you did. If you're less than 5 years in practice, please keep in mind it could be that you're going too hard. It could be that you're a little rough. That's normal in the beginning. But I think that the schools do a really good job of training us. And I'm pretty sure that the vast majority of these things, when they come in, when the patient has gotten worse, are issues about what they are doing or what they're not doing. So you got to be a little bit of a detective, and you've got to talk to them and figure out what's going on. So I'll share a few stories with you. The guy that I'll continue talking about, the guy that thought I pushed everything the wrong way. So I found out by asking him that he felt great when he left, and he felt great for a couple days. It was really 3 or 4 days later that the pain came back. So to me, in understanding how the body responds to trauma, that wasn't about what I did in the moment. I didn't over-adjust him. What was happening is he was going and crawling under desks and carrying heavy tools and looking up at odd angles, and that was the thing that was making it so that we couldn't get his neck better. I had a gentleman come in just a few weeks ago who was coming in for low back pain. And he'd been a patient on and off for a few years, and I knew him pretty well. I think I knew him from yoga. And he came in for a follow-up. I had adjusted him a few days earlier, and I said, "How are you doing?" And he said, "Well, I'm not doing very well. My neck hurts." And I said, "Oh my gosh, I'm so sorry. When did that start?" And he said, "Well, it was a few days after you adjusted me. You adjusted me too hard." And I said, "Well, seeing as it was a few days later, that's probably not what happened. I think what's happening is it's a postural issue. Your low back's a mess, and I'm doing full spine adjusting on you so that you can stand up a little bit straighter. There's a lot of compensation from what's happening with your back, and your neck is having to now readjust to a new posture. And I think that's what's going on." Well, he wasn't having it, and I wasn't having it either. I think it's really important that you stand your ground with your patients if you feel like you were right, but also don't argue with them. Lawsuits are rare, but if they're annoyed with you, if they don't like you, if you argue with them, if you give them a hard time, that's much more likely to be somebody that wants to sue you. So I just apologize and say, "I'm sorry that happened, but this is what I think is happening." It certainly can happen. It certainly can happen. But I think that what I want to get across to you is don't take it personally. I had a guy come in, another gentleman who was coming in for low back pain, and I worked on him, and he felt great. And then he came in about a week later, and I said, "How you doing? How's the back?" And he said, "Well, it's really crappy again." But what he did, and he knew he did this because he told me, and he actually said, "I'm sorry, I messed it up again." He was feeling so good, he decided to clean out his garage. And he was picking up large boxes and just overdoing it. So he knew that it was not what I had done. I had another woman who was coming in. This was many, many years ago. I was brand new in practice. I think this also was in my first year. She was a PhD student, and she was writing a dissertation. So she was coming in for pain at the cervical-thoracic junction. Very classic office worker kind of thing. And I was really happy because I knew what to do for it. And she felt great when she left, and she felt great for a few days, but the pain just kept coming back. And she was coming in weekly, and she was a grad student. She didn't have a lot of money. I felt guilty. I felt terrible. I was like, "Oh my gosh, what am I doing wrong? I can't get her out of pain." So I was pretty good though. I remember this because it was really the first time where I thought, wait a minute, maybe there's something else going on. So when she came in for her appointment, I started asking her questions. I asked about the keyboard and the mouse, and they were all fine. And I said, where's your monitor? And she said, oh, it's over there. So there's the reason I couldn't get her neck better. She was sitting typing and she was doing this all day long. You can't do that. So I could have easily blamed myself and felt bad. But what I did was actually perfect, even though I'd only been a year out of practice, is figure out what could possibly be causing the pain to come back. If they walk out of your office and they're in pain, it's probably what you did. It's probably what you did. If they came in without pain and they walk out in pain, yeah, maybe it was an overadjustment. It certainly can happen, and I wouldn't argue too much with people when that happens. But if it's a few days later, there's something else up. It could be the approach. It could be they need something a little bit different than what you're doing. But it could also be that there's an ergonomic issue. There's underlying dehydration will cause this as well. People that are dehydrated hate me the next day. I make sure I ask everybody about their water intake when they come in. And I make sure that they're drinking enough water, because if you're not and you get active release technique or a chiropractic adjustment, you could potentially be super sore the next day. So I make sure that they know that and that they drink water. And if they don't drink the water and they're sore, they know why they're sore. So the gist of this whole video really is, don't jump to the conclusion that it's you. Don't take it personally. But also, don't be arrogant. And if you're hearing this more than just a couple times a year, it could potentially be you. And there's some things you can do to make sure that that doesn't happen. But don't take it personally. It can turn into a mind trap. It can turn into a real drain on you. And you need to not be drained when you're working. You need to be up and happy and perky and be there for the patients. And they can tell if you're not. And it's going to affect your business if you're not. So the point of my coaching is really to get you out of your head, to get you out of those mental traps that just keep going and going and going and going. If you're like me, if you're not, then you don't need me. Then you're awesome. Just watch my videos and have fun. But if those mental traps keep popping up, do give me a call. I'm coaching. I'm working as a mentor for doctors, and I can help get you out of your head. I can help you stop taking things personally, and I can help you have the practice that you dreamed about when you were in school. So thank you, and there's more videos coming.